So basically, you have to go down to that pre-symptomatic situation. Either the patient is not getting enough blood to the brain, or if he's not getting enough, if he is, then maybe he's not getting appropriate quality of blood. Maybe it's hypoglycemic, maybe it's hypoxic, or any of those kinds of things that we have to look at, which is what's causing it. And as I said, this is the first question because lots of people get excluded here. But if you pass this test, then you come to number 2. Is it central or peripheral? So again, as I said, that people say that we don't understand enough, but I think we do understand enough. This is all you need to know out here. Of course, we know that we balance ourselves on the basis of some reflexes, automatic reflexes which are always going on in your body, which has an afferent component, a central component, and an efferent component. So you have the visual reflex, the visual oculomotor reflex, you have the visual spinal reflex. So what's the visual oculomotor reflex? If I push to this side, my eyes automatically come here. When a cricketer tries to catch a ball, he's moving on one side, but his eyes are automatically moving to the other side. When you are on a bus and you are reading something and the bus is moving, your eyes are automatically responding. It's really also what you call the pursuit reflex. So your eyes automatically perceive what you want to perceive. But there is also the vestibulo-ocular reflex. The vestibulo-ocular reflex is that the vestibule perceives the movement and the eyes go accordingly. So out here you have all these afferents and out here you have all these efferents. So you have the vision which is an afferent which automatically gets the eyes to move and follow the object, which is the pursuit reflex or the visual oculomotor reflex. You have the vestibulo-oculomotor reflex, which basically is that if I am suddenly pushed to this side, my eyes automatically turn to the other side. If I am pushed, my eyes will go there. That point of view, if you have a vestibular vertigo, and it may occasionally originate in the vestibular nucleus, so very unusual for isolated vestibular nucleus because it's such a small area, something else is going to be involved with it. But even if theoretically you think of it, so peripheral situations will be in proportion. So if you have a central proportion, you may have vertigo but no nystagmus, you may have nystagmus but no vertigo. You may have autonomic symptoms or not have autonomic symptoms. But here, when you have a classical vestibular attack, you will have rotatory vertigo, they will feel nausea and vomiting, they may feel sweating and a sinking sensation, and they will have associated nystagmus, which is typical of the peripheral kind. You may have to unmask that nystagmus because the nystagmus would get masked or get pushed down by the